So, hello everyone. I'm a sixth year medical student, and today we will discuss the University of Medical School in Debrecen. So, now the general medicine program started very long back in 1918, and it's since 1987 that it started in the English language program. So, you see, it's been a very long time since this university has been teaching medicine to English students as well. Now, there are several different programs in the medical school, which we have medicine, dentistry, pharmacy, and several other BSc and MSc programs as well. Now, the University of Debrecen Medical School, first we have the pre-medical studies for those students who feel they are not prepared enough to start the medicine school. So we have something called the basic medicine course or the foundation year in medical studies. Now this can be a intensive course of 1 semester which starts in January, or it can be a 2 semester course which starts in September. Now they mainly include subjects like physics, chemistry and biology, and the entry requirements are a high school diploma and an entrance exam into this course. Now, the University of Medical School, the entrance exam for all the foreign students for medicine, dentistry, pharmacy goes through the same process. So, first, there's a written exam in biology and chemistry or physics, which takes about 1 hour. And then there's an oral exam, which is compulsory in biology or physics and chemistry. Now, usually before the exam, you will be given a list of topics that will be discussed, and that's what the exam is going to be about. However, for the BMC and MSc courses, there is no written exam, it's just an oral interview. And during your oral interview, you will also be assessed for English language speaking skills. Now, our university has several international recognitions. First of all, is recognized by all the European countries and the World Health Organization, including the councils of UK, Ireland, India, New York, and California. So, in case you want any preparation courses, for example, USMLE Step 1, the university offers Kaplan preparatory courses as well. Now here we can see the faculty of medicine. As you can see, it's a pretty big faculty we have, where within the campus itself we have several departments, and these departments we have around 3 million patients per year, and there are several of these clinical departments within campus where we can get direct contact with the patients. Apart from this, we also have more another part of the campus as well, as we can see here, and here we house a lot of patients, and like because of these a big amount of patients that we have, we can have a lot of interaction with the patients, see a lot of different kinds of cases, also have personal history taking with the patients, etc. Now, let's talk about the faculty of medicine and the requirements. So now the medicine faculty consists of 12 semesters, which is divided into 6 years. It starts in September, and the language requirements is the English language proficiency, which is assessed during your entrance examination. Now, the academic requirements, however, we need a high school certificate with at least 12 years of education and passing the entrance exam in biology and physics or chemistry, both written and oral. The tuition fee is $16,900 per year, and however, there are other fees like application fee and entrance fee procedures. Now, during this 6-year medicine program, we have to collect 360 credits all across these 6 years. So, in the first 2 years, we learn a lot of theoretical subjects. So, in the first semester, we start with biophysics, medical chemistry, biostatistics. Now, these are starting off courses because all of these are required for several subjects later. For example, biostatistics is involved in preventive medicine, and biophysics is important to study the radiology as well as other subjects. And now, apart from that, one of the hardest subjects that I found was anatomy, histology, and embryology, which starts in first year and goes on to second year. Now, these are very highly theoretical subjects, and it's something you haven't learned before. So, finding out a different pattern of studying is also important during these years. Apart from these theoretical subjects, we will also have a lot of lab practical skills like in biochemistry and several, and including others practical skills in anatomy, such as dissections of the bodies, etc. And during these 2 years we can collect around 124 credits. And then in the third year we start the preclinical block, where we now transition from theoretical to more clinical knowledge. So we have subjects like microbiology and pathology. Now in these subjects we learn about the different types of diseases and the basics of principle of patient care, and we also start some subjects like internal medicine, the basics. Then we move on to fourth and fifth year. Now, these are the most highly clinical years where we learn a lot of clinical subjects and practical skills. Now, it's in these 2 years where, apart from having normal classes, we also have separate block practices where we have to be in the hospitals or clinics all day. We have duties. We'll have a lot of patient interactions, etc. So during these years, we learn all the main clinical subjects: cardiology, neurology. Then we have surgery, etc. Finally, in the 6th year is our 6th-year rotation. Now, in this year, we basically have 6 subjects, which include internal medicine, OBGYN, surgery, psychiatry, as well as other subjects like pediatrics. Now, what we do in this year is we have rotations in each department, and after the rotation, we have an exam for that subject. And basically, it's an internship year. And so these exams all accumulate up to 35 credits. And the practicals is the minimum requirement. We need 35 weeks in total rotations in 6th year in order to complete your 6th year education. And as you can see, the distribution between lectures, practicals, and seminars, we focus a lot on practical skills because obviously it's medicine. During the lectures, we focus on theoretical subjects, and in the seminars, we learn how to use the theory and learn theoretically the practical skills. And finally, in the practical labs and in the clinics, we put all our knowledge into use. Now, as you can see, this is an example of what happens in some of the practical classes. Now, here we have emergency medicine, anesthesiology, which is all presented in these pictures. And here, this is the Department of Surgery and Operative Techniques. We can also see some radiological developments and techniques that are used in our labs and surgeries. Now, finally, in medical school, apart from this, we have several other faculties like pharmacy, dentistry, and health sciences. If you would like to know more about these programs, you can visit the website where you can also get a full list of all the BSc and MSc programs. So with this, I would like to thank you all for your attention. If you have any more questions, you can message us at our email address info@edu.unidep.hu, and you can also check out our websites for any other information as it's pretty well maintained. And with this, I'm looking forward to seeing you all here.